once you see the airway problem, you can't unsee it. Even patients are telling me that. Once you see something where your eyes have changed and how you see it, it becomes very, very obvious.
I'm Mark Cruz. I'm an airway-focused dentist that advocates for wellness. My mission is to help you transition from disease management towards true wellness, starting with your airway. When your airway is limited in any way, it affects your sleep, your health, even your smile. We treat root cause, not just the symptoms, so that you wake up refreshed, live fully, and smile freely. Visit our website, markacruzdds.com. Breathe, sleep, and be well.
Let's take a look at why integrative teamwork in airway health is still harder than it should be and what needs to change. Welcome, everyone. I'm producer and co host Julie Schwenzer with Dr. Mark A. Cruz. Dr. Cruz, it's a pleasure to chat with you again.
Good morning, Julie. Thank you so much.
Yeah, we're excited to dive into part two from our last episode of how airway dentistry challenges traditional dentistry. And specifically, can you discuss what barriers, whether it's like cultural, educational, or systemic, make it difficult to collaborate with healthcare providers in different fields?
Yeah, so that's a little bit of a multi part question. I'll just say the difficulty for, let's say, dental providers at this point is really an educational barrier, really understanding what it means to practice with an airway focus. It's not in lieu of um, traditional general dentistry, it's actually in addition to. So it's a way of looking at the patient. The other part is really the integration across or that transcends dentistry across disciplines in healthcare, like with our medical counterparts of various specialties. So that creates its own challenge just in and of itself because dentistry's been somewhat siloed away from our medical professions, um, which is somewhat artificial. It used to not be like that decades ago, but then it became almost its own specialty within healthcare, and that those barriers are starting to be broken down with the advent and understanding of an airway focused approach to treating the patient. So, two sides to that. So, talking about the dental provider, right now, we're just in the throes of almost hitting the tipping point where the discussion and understanding of what it is to practice airway focused dentistry is really come of age. A number of things. The American Dental Association, a few years ago, actually passing a resolution saying that we must start screening for obstructive sleep apnea, which is really very a low bar, but it's a start because this goes way beyond obstructive sleep apnea, which is an end stage diagnosis. Um, Moreover, I argue with an area focused approach to dentistry, we're really talking about breathing versus sleep, disordered breathing during the day and during the night. So if you can't breathe well, either because your nose is clogged up or congested or has some kind of obstruction, then it's going to also affect your sleep. And those dots oftentimes are not connected. And why it's important to the dental provider is that more often than not is has to do with craniofacial growth and development. So how the child grew into an adult with a very constricted, underdeveloped midface that gets treated with, nasal steroids and surgeries and things like that, over treating the wrong problem. That really falls into the domain of dentistry to a large part because the palate and the oral cavity is a structure that we see and treat every day. And when we expand, say, on a child, what we say expand, meaning that we widen it, we're actually addressing the nose, the nasal fossa, because it's two sides of the same coin. It's the second story of this two-story home called the nasomaxillary complex. So once you start understanding that and the effect, excuse me, of flow limitation on the dental structures like accelerated wear on the teeth, fractured teeth, mobility, erosion from reflux, um, all these things that we treat that lead to also problems with temporomandibular joint function and the like. Um, when you start understanding what it means, then you could start really treating root cause. Okay, so that's for the dental provider. For the medical provider, it is so siloed that the cardiologist doesn't really talk very much to the pulmonologist. It doesn't really talk to the urologist, and it's just really a hyper specialized siloed disease management healthcare system. So it's difficult to break through those silos in large part because it's been baked into the cake, meaning that the way that provider gets paid is governed by the rules of engagement, if you will, financially from the third party payer. The Blue Shield, Blue Cross, Medicare. And Medicare is the tail that's wagging the dog. It pretty much sets the table for the rules that most third party indemnity insurances or HMOs follow. And so it's not really based on patients' health and wellness. It's just based more on a way that the provider gets paid. The rules are, this is the way it is, and it prevents you from looking beyond the very restricted view that the physician may have of the patient, where they have limited time and it's very pharmaceutically driven. It really makes it very difficult to change that or convince a provider because they're family people as well, right? They have families to go home to and deal with and beyond their patients, and they can't be fighting hour to hour with a system that gets in the way of their job, if you will. So it's just a real big problem. The system is broken, no question about it. We've talked about that. And how can we say that? Well, just look at the health of the American public. It's we're not getting healthier, and the cost is going way up. More chronic disease. Our kids are getting sicker. They're not going to live as long as their parents now. And so, if the healthcare system is really doing a good job, it actually would be getting better. The cost would be going down, and that's just not what's happening. So, to answer your question in a kind of a two-part dyad, if you will, the medical provider and the dental provider, the challenges that are brought in practicing with an airway focus, those are the two general um, explanations, and I hope that makes sense.
Yeah,
Yeah.
absolutely. And you're a great example of somebody who went beyond his traditional practice and expanded and also faced systemic issues, but you still did it.
Yes.
So, my question to you is what advice you have for clinicians who want to bridge that gap because you've done it and you didn't let yourself be siloed as you mentioned that word. So what can they do? What's your advice?
Yeah, so when I started 15 years ago, the discussion of airway just didn't exist. I mean, there were one or two different groups that were just starting to talk about it. One in the East Coast, and and the focus at that point had been on obstructive sleep apnea, sleep dentistry, sleep medicine. That's different than airway focus. So I never was really that interested in dealing with sleep problems as a dentist because I didn't really quite understand it. Moreover, I knew that it really went beyond that. And so as I started connecting the dots and giving courses and training colleagues, what I noticed and experienced is all these colleagues would be at the end of the course or at the end of the day in a particular course session would say, wow, why didn't I hear about this before? It makes so much sense. And jokingly, almost everyone would say, once you see the airway problem, you can't unsee it. Even patients are telling me that. Once you see something where your eyes have changed and how you see it, it becomes very, very obvious. And yet, getting from there to actually translating into real world practice is no small matter because you're really going up against a system that's already been set up with all the workflow and the way you get remunerated for your services, et cetera, et cetera. Well, I lived through that with many arrows in my back where it was like there was no evidence and this doesn't make sense because it really challenged the orthodoxy. And I think what happened for me is I really delved into the medical literature versus just the dental literature. Whereas at that point, is mostly the dentists staying within their own silo of the dental literature. So they'd say, well, there's no evidence. Well, there's no evidence, perhaps, as you see it in the silo that you're looking, but we need to understand that there's a huge knowledge base that we need to transcend beyond our silos. And so I went through out of necessity developing different services protocols and curriculum to make it today something that is fairly straightforward in learning and translating it to where you can actually benefit your community, your practice, your team, your patients. And so that's its own discussion. But it came with a lot of, I have to say, it came with a lot of pain. And even today now, the people who were saying that there was no evidence now, they're becoming quote unquote airway focus gurus. So it's kind of a funny thing that what happens is, no, what you're saying isn't true until you see it, and then, oh, I've been doing this from the very beginning. It's just kind of, it is what it is. It's human behavior, but I think that we're in a very exciting place right now in healthcare and certainly in dentistry. So I hope that answers the question, even if it's not in a direct way.
Yes, it does, and I wish we had more time to
Sure.
discuss this, but,
Yeah.
thank you for breaking down, these barriers so quickly, what you're facing as a dental and I would say medical professional and explaining this. I think it's gonna help a lot of people, so thank you.
Thank you, Julie. Appreciate it.